Till the 80s, that is 1980s, people, including the medical fraternity, thought that management of a sexual problem is a luxury. It's not necessary. It's a luxury. Then came the discovery of Viagra. Then the thinking changed. Then they said that management of sexual problem is only necessary for elderly population. Subsequently, around 2000, they said sexual problems are due to lifestyle disorders. The current medical research clearly tells us that organogenic, that means due to physical factors, organogenic erectile dysfunction is the earliest independent marker for a future heart problem and heart attack. Now, how is that the erectile dysfunction can affect or produce a heart problem or heart attack? How are penis and the heart linked? The link is the blood vessel and the inner lining of the blood vessel known as endothelium. Endothelium, the inner lining of the blood vessel, is the seat of many chemical reactions. Only when these chemical reactions function properly, it can expand or contract, thereby determine the amount or quantity of blood flowing through the arteries, thereby to the organs in the body. When the physical factors affect this inner lining, endothelium, then it cannot function properly, it cannot expand properly, so will not allow the blood to go properly through the arteries to whichever organ it is. So, the endothelial damage will prevent the blood vessel from dilating or expanding to allow sufficient blood flow to go to any particular organ. And when it affects the penis, the blood vessels in the penis known as cavernous arteries, they will not receive or allow sufficient blood to flow into the penile tissues. So erection is affected. If the blood vessels in the heart, namely coronary arteries, are affected, sufficient blood will not go into the heart, producing heart attack. Now, when the endothelial damage occurs, it occurs simultaneously throughout the body. It doesn't specifically target one organ or other. But the manifestation of the damage is occurring, can be seen by our naked eye, by the penis. It takes some time for the damage to manifest in the heart. The reason is simple. The diameter of the blood vessel in the penis, cavernous artery, is only 1 to 2 millimeters, where the diameter of the blood vessel in the heart is 3 to 4 millimeters. So, same damage occurring will manifest quickly earlier in the penis and little later in the heart. The risk factors for both heart attack and erectile dysfunction, physical reasons, are the same. Diabetes, blood pressure, obesity, depression, smoking, sedentary lifestyles, etc., 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 high cholesterol. That's how what affects the penis will affect the heart also. We must understand that. That is why today doctors will say, if a man comes with erectile dysfunction due to physical factors, please check his heart status so that you can prevent a future catastrophe. Medical research clearly demonstrated that if a physical factor induced erectile dysfunction goes untreated, it will result in heart attack between 1 and 7 years later. So protect your penis as well as your heart.